Hello, I'm Corinne. I'm the Respiratory Clinical Nurse Specialist based in NHS Highland, and over the course of the last couple of years I've been using Florence Telehealth within my asthma population, those people with asthma who have either presented to secondary care with an acute admission or those that are struggling in primary care to achieve satisfactory control.
My name is Mary Ross. I'm the physiotherapist for NHS Highland, vascular physiotherapist, and I've been using Florence with my intermittent claudication patients.
My name is Fiona. I'm a diabetes advanced practitioner podiatrist for NHS Highland and a clinical champion for Diabetes UK. The podiatry team, we use Florence to encourage patients to check their feet every day and also to encourage them to contact podiatry services if they have a foot concern.
I'm Mary Wotherspoon and I'm the lead dietitian for the Specialist Weight Management Service, and I work for NHS Highland. I use Florence with my patients to support them with weight management.
My name is Sharon Smith. I'm a speech and language therapist working for Highland Council. So I use Florence to support training that we do for early years practitioners and primary staff. We use Florence to help them embed the key messages that they have on the training.
My name is Duffy and I'm a community respiratory nurse specialist. I work in NHS Highland. We use Florence Light Touch for COPD as part of the management of patients with COPD in the community, and it's really a self-management tool which we've based very much on our written self-management plan.
There was a certain cohort of my asthma patients that I was losing sleep over. We've all in this speciality seen these type of patients that are presenting 3-4 times a year into secondary care really poorly. And really I was looking at something that would help me in my consultations to get these patients to engage with healthcare services more effectively. So what Florence enabled me to do was to remotely monitor this group of patients, as I say, that were at risk of dying from their asthma. Certainly what we've seen is that our patient group has loved this protocol. They're engaging with us, they're adhering to their medications. If their asthma control is deteriorating, they're seeking medical attention in a more timely fashion.
It could be of great benefit. The main issue that we find is it's having the time to look at the results as they're coming in. But when it does work well, which I was able to review a patient on Florence prior to seeing him, it was really, really good because I could see all his step counts coming through. I could see that he hadn't been doing his exercises. I could see what his risk factor control was, and when he came in, we were able to kind of go through it. It was a much more holistic patient review assessment.
Florence acts as a continuation of the podiatry consultation, and it helps to motivate, empower and give patients the confidence to maintain better foot health in diabetes.
It's a practical tool to support the approach. It's another tool in the toolbox to support patients, and it reminds patients to eat to appetite when I'm not there.
What we're asking practitioners to do is to take something from the training and embed a change in their practice, everyday practice. And that's really hard to do. And we're looking for practitioners to make changes in their practice across Highland. And we obviously can't support all practitioners across Highland to do that. So Florence is another tool in our toolkit to help them make that change. Florence is another tool. It's when we're not there, it sends them messages to say, this is what we talked about on the training. Remember to do this. Have a look in your setting around what you're doing. Remember we talked about this. And also rate how you're doing. How's it going? It's there when we're not, and it helps them to think about things when we're not there.
So in my job role, Florence has been a really good tool for helping reinforce the health messages that we give to people in consultation. It saves us from having to chase up people to stay connected. Florence does that for us, and certainly that's what our patients tell us that they like the best. They feel connected. The longer we use Florence, the more we're learning that it's about the reinforcing. It's the same messages that we're giving them, and that reinforcement is really helping it to be valuable learning for the patient. So it saves us a lot of time. And I think when we use Florence, it's almost like what we would wish to, the service that we would wish to give everybody, but we have a huge caseload and we live in a really remote and rural part of the world. And so we're not able to do that in person all the time. And I've noticed that Florence really helps us to stay connected to people. The whole of the healthcare team, certainly in COPD, are really liking it, and it's really to do with the fact that they can be connected to their patients, and it's saving them a lot of time.
I can't underestimate really the difference it's made to my job planning. I know now that everybody that I've got enrolled in Florence has an electronic asthma plan. So I know that these patients have got the tool that if their asthma starts to deteriorate, they get a responsive message from Florence. What we're seeing is these patients that we're presenting time and time after again, 4 or 5 times a year, they're not doing that anymore. They're empowered over their asthma, they're adhering to their therapies, and they're actually self-managing far more effectively than they ever were previously. With regards to actual job planning, these patients that I was losing sleep over, I now can remotely monitor them. I'm not needing to call them to my outpatient clinic as often as I once was. Sometimes these patients I was seeing in outpatients 3 monthly. I've been able to extend that to 6 monthly, to annually in some patients, which for the board level has allowed me to, reschedule an outpatient clinic into a difficult asthma clinic. So it's a win-win situation. Ourselves in NHS Highland, we had to think outside the box. We've got patients that are maybe doing a 4.5 hour, return journey to our clinics. There was a considerable time at the beginning when we created the protocols, but I think we've certainly reaped the benefits of that because it's allowed us to really tailor that protocol to what we require within our service. And now, I have nearly 100 patients on active monitoring, which I physically couldn't be calling to clinic, 3 monthly, 6 monthly.
With NHS Highland, as you know, it's really remote and rural, and I get referrals from people Wickford, so they're not going to be trotting up and down the road every week to see me. So it is really good from that point of view that they can remotely put in the information that they're asked for, and we can see it here at Wigmore, and that has to be a benefit.
Florence for foot care is simple and easy to use for our patients. The challenge that we have in diabetes is that foot ulcers are sometimes difficult to manage and heal. It's suggested that 40% of foot ulcers lead to amputation. It will offer patients support and advice on foot care measures, and it will reinforce and raise the awareness of better foot health. The overall potential is that Florence may lead to a reduction in foot ulcer occurrence.
It's a very good way of helping patients to self-manage, and it's not always easy for one to grasp the concept of eating to appetite in one session. So to have flow as a support to prompt them to think about intuitive eating is a great asset to the service.
I think for me and for us as a service, I would say it does take time, because it takes time from an administrative point of view to put people onto the system. But knowing that we have another tool to help people embed change is really useful. We've had lots of people sign up to it and lots of positive feedback from it, which helps us to know that that's a really useful tool.
For me personally, it saves me time in so much as I don't have to, if I think someone is verging on the edge of a flare-up or an exacerbation, I don't have to then worry and try and chase up and see how things are. I'm able to look at their readings. It allows me to keep an eye on people without it spending lots of time on the phone chasing up people. So it saves me a lot of time. And also there's there's something really valuable about being able to have that conversation with someone. So I'm at my desk in Inverness and I'm able to look at their readings, their physical readings, and so the consultation over the phone, if we have one, is very much relevant to how they're feeling at that time. So the plan of care sometimes, I think, can be much more person-centred. Some of these people live 200 miles away, but a consultation over the phone is really just as valuable, and we have these readings to base that on. It's much more structured and person-centred, I think.